We are talking today with our experts about diabetes and how to control it, and right now we're talking exercise.
Yes, thanks for joining us today. This is Locke with us, and we've got some information about proper exercise. If you have diabetes, it's important to get exercise. What kind of exercise should you get?
Well, absolutely. You need to be getting 30 minutes a day, and you need to make sure you clear that with your doctor. There may be other medical reasons that might be limiting how much exercise that you should be getting, so make sure you clear it with your doctor. But if you're not doing anything, just start with 15 minutes. 15 minutes a day will help, and there's many benefits of exercise.
Sure.
And when you say you're starting out, does there have to be a certain intensity, or just moving in general for 30 minutes, whether it's a walk or a bike ride? Does it matter what you're doing?
Well, if you're just starting out, you should just start moving, and then you should try and increase the intensity to be moderate or even vigorous, because exercise will help those with diabetes to control the insulin levels. They'll also help control weight, and it's been shown that if you reduce weight with diabetes, you'll be able to tolerate it better. And if you don't have diabetes but are at risk, it's really important to exercise so that you can reduce that risk.
Is it possible you can over-exercise and injure yourself? Are you more susceptible to that if you have diabetes?
Well, I think there's always that possibility, and you should, be aware of your own, how you feel. And when you just start out with exercise, you'll have some muscle soreness and some difficulty that way, but that's okay. If you start having joint pain, or if it lasts for more than 24 hours, you should maybe back off a little bit.
Okay.
And I'm assuming it has to help with everything from stress to depression. A lot of it can go along with the stresses of diabetes and having an illness in your life 24/7.
Exercise and just being active and outside, it's a breath of fresh air, and you can just feel better about your life. And you're right. People get discouraged. You just found out you have this disease, and or you've been struggling with it for years, and getting out and moving will help you with just positive thoughts and positive attitude.
Okay, and we want to let our viewers know that we have our friends from Intermountain Healthcare here on hand. There's a phone number should pop up on the screen here. You can call and get some medical advice right now. I'll just tell you that number. It's 877-908-0680.
Well,
Magically appear.
There you go. Locke Ettinger joining us here today with a little bit of inspiration for all of us, whether have diabetes or not, to get moving. It's always
Absolutely.
good for you.
Let's all get moving.
All right.
Thank you very much.
Thanks.